Lifestyle.
It was the first ever children's hospital set up to cater for the needs of maternal and child health care in Ghana. Today, Princess Marie Louise Hospital is 90, and there is a fundraiser, God willing, Friday. So we've been joined by the board chair in the person of Father Neelante Campbell, and of course, pediatrician Dr. Mamiya Nyako, head of clinical services, Princess Mary Louise Hospital. Good morning and welcome to our show.
Good morning.
Doc, I got it right.
Morning.
Okay.
It's good to see you.
Thank you.
This hospital is 90 years old?
90 years old.
90.
Can you imagine? 90. Long time.
Wow.
And a lot has happened in those 90 years. And we're celebrating it. So we have the fundraising on Friday. And then the 25th of June, we'll have the anniversary day itself at the hospital.
Father, you said a lot has happened. Can you walk us through
Ever since it was founded.
it all? Yes.
You know, long before I was born.
Yes.
Back to
You have been with the facility for a long time.
Oh, I've been there since, long
challenges,
time.
I know that it's
I remember
not
going,
without the challenges.
going there the first time I went in 1976. I went there, and the new 4-story block behind, it was just a shell, and it was just the old building, and just 2 doctors. So I've seen a lot happen over these years, and then we had to finish that new building. We had to get equipment. Then we had to get more doctors. So at that time it was just mainly for the children, malnourished children. But now we have it for all types of diseases and the rest. So we've gone a long way since that time.
Indeed.
Dr. Nyako, so you're head of clinical services. What does that mean? And I'm sure you have more than 2 doctors now.
Oh yes, but we still need more.
How many doctors do you have, by the way?
We have 5 permanent doctors currently. Yes.
All right.
5 specialists and 1 medical officer.
Okay.
Yes.
And when you say clinical services for the Joe public, what does that mean?
Well, basically that I'm in charge of the doctors, ensuring that we are able to offer the services that we want to.
Are you the only specialized clinic for hospital for children in this country?
I think there's one in Kumasi. It's not as big as Princess Marie Louise, but for a purely children's hospital, we are probably maybe the biggest in the country.
And what are the ailments that children normally come down with and that have to come to your place? What are the common conditions?
So we are a general pediatric hospital. So most of the children that we see have infections, different types of infections. Sometimes we see children who may also have more severe illnesses like a heart disease, kidney disease. So depending on the severity, we may have to send them to a tertiary facility. But as you know, PML started taking care of children and mothers, and then it became more famous for nutrition problems. So we are one of the centers in the country that take care of severely malnourished children.
So I know the focus, like you say, is on child health delivery. You also look at maternal health care.
Currently, no.
Okay, so the focus now is on child health care.
Yes.
What are some of the new specialties, apart from nutrition, that you talk about, in terms of pediatric care, have we introduced to the
Okay, so
hospital?
now we also have a surgical unit. It's not, should I say, to the maximum, because currently a lot of cases that they do are day cases because we don't have an in-house pediatric surgeon. So we have the pediatric surgeons coming from the teaching hospital to help us. We also have some general eye and ear, nose and throat services, and then we also have dental services for children. In fact, the dental service is also open to adults.
I think that early on in the year, there were some reports of increased teenage pregnancy cases in parts of the country. Do you record some of these cases at the facility as well?
We take care of the children. And what we've realized is that, yes, I think it's very true, because the beginning of the year, we've seen quite a number of children with teenage mothers.
Okay.
And it's quite a challenge because most of them may not have family support. They don't have the finances to take care of their children. some of them are not even eating well. So we've had a couple of them also coming in with their children severely malnourished, and the mothers also malnourished.
It's a lot of work you're doing there.
Yes.
Mr. Board Chairman, Father Nilante,
Yes.
what does the hospital need and how much money are you looking for?
Need. 10 years ago, we celebrated our 80th anniversary. And Major Kwashiga, who was the Minister for Health then, he got the sod for a new 3-story surgical block. Now, through God's help and many benefactors, we were able to open that surgical block in 2013. So we get more patients now, more patients. We get with the operations there every Wednesday. We've done over 1,000 operations since we've opened that particular unit. So we have more patients coming to the hospital. So we need a new building. We need better facilities for the X-ray, for the laboratory, and for the pharmacy. So we want to build this new building to help us to be able to cater for the new people coming. And all we need is $600,000 to be able to put up a 3-story building. When we started the building, going back, was it 10 years ago with Major Kwashiga, we didn't have 2 pennies to rub against each other. We just had faith in God. And then we went around with our hats and we started begging. We begged all the banks. We went to MTN, we went to Tola, we went to all sorts of places. And 3 years ago, on the 30th of July, we opened the new building. And we invited all the benefactors to come. And I showed them, I said, here's the financial report, and here's your building. We don't owe anybody any money. By the grace of God, this building is up. So we have faith and trust. They will do the same. They will also get the money. So we're looking for $600,000.
Is that what the building looks like?
This is
Show it to the
building.
camera, yes.
This
so
is
this
the
is what
building.
we are going to build with
Yes,
this. What
this
will
is
be
what
in
we're
this
doing.
building?
Laboratory, X-ray, and pharmacy.
Okay.
So to cater for the new people who are coming in, because we need the facilities. That we need.
$600,000. And the fundraising event is when? This
On
week?
Friday, on the
Friday.
coming Friday, a British Council with the Winnipeg Youth Choir. They're coming. They've always supported us,
Yes.
supported us with the children's hospice orders, with the lepers. So they've done a lot for us. So they're coming to sing for us. And we're hoping that, maybe some institution or other, they're celebrating maybe their 50th anniversary or their 100, whatever it is. Father, we'll sponsor one floor. I'd be happy. We'll name it after them.
Okay.
So that we'll be able to, one way or the other, maybe some donor will say, Father, I'd like to support and I'd pay for such and such.
Yes.
So we're hoping and praying that the program this morning will touch people's hearts, and touching their hearts will also touch their pockets. So that
Very important.
on Friday,
Connection from the heart to the
you've got
pocket.
to go from the heart. Oh yeah, I mean the love of children. The love of children. You want to do something, it'll touch your heart though. Because it has to go to the heart first. Then your heart goes to your checkbook. And then your checkbook. And then we'll hope that people will come and support us and be able to say, Father, here's something, I want to help the children. Because the children are the future of tomorrow.
Yes, indeed.
So we have to take care of our children and look after them. And we're doing that very much. Every day we have about 150 to 200 children, the outpatients. Every day.
On daily basis.
Yes. So we take care of a lot of children. A lot of children we look after. So I must say, I must commend our doctors. We've only got 5 doctors.
Yeah.
Have we 5 doctors?
Not much
For the
from
whole
Because we are not
hospital.
training enough doctors. Or we don't have a lot of
Look,
doctors.
I've gone to the Minister for Education. I've begged him for more doctors. We have a NICO unit there for 2 years. And we've all the equipment. Donors gave us the incubators and us. We cannot open the unit. It's not functioning. We've no doctors.
Yeah,
If
nobody
you go
can
to
run
the
it.
NICO unit at Kolibu, our military, our ridge is packed. It's packed. Here we are with an empty unit, and we've no doctors.
And the equipment is there.
You
ready
should see
to-
the equipment.
fresh,
yes,
brand new,
beautiful,
spanking brand new.
equipment.
Wow.
And I feel embarrassed, when the donors come and say, "How is the unit, Father?
It's not
How
up
is it?"
yet.
And it's not even open.
Wow. So that's an opportunity for some young doctors to go there.
I've gone personally to the Minister for Health, and I've asked him, and he even came to the hospital, and we showed him the room there. So we need help.
We need help.
So 5 doctors is not sufficient.
We need
for
more.
a hospital like this.
We need more.
24-hour coverage, and you want just 5 doctors to take care of a hospital, 150 to 200 outpatients a day.
Daily.
You're taken care of, and now these the extra those for the operations every week.
Yeah,
we need
it's a lot of work.
nurses.
I know somebody is being touched right now. If somebody wants to give it even ahead of the fundraiser on Friday, what's the number to call? Is there a number that
You
we
can
can
ring
call?
my number.
Okay.
My number 024 332 6643.
024
332 6643.
All right, and we'll put that number up on our social
We
media
have
as well.
a bank account at Barclays.
Okay.
Princess Marie Louise Development Fund.
Okay. So
we
that's
have
your
a bank
Barclays account.
there, yes.
Okay.
So we'll be able to, people can donate, or they can come to the hospital to see doctor, or they can come to Christ the King
Okay.
and donate at the church there.
Okay.
All right, come on Friday. Come on Friday with your checkbook.
British Council.
British Council,
Time.
6 o'clock in the evening.
6 in the evening after
Come
work.
and enjoy the beautiful music. You know, when about youth choir,
Yeah.
they
Oh,
really
yes,
they
we
touch your heart.
choir,
They touch. They really touch us. They will sing well and they will help us in every way. So we're praying for God's blessing on Friday.
I know the Minister of Health has promised some 4 doctors at your launch. Would that make anything, things better?
So far,
Nice.
Okay.
they have
Yeah.
All right.
And
And the last
Mami,
word?
as we wrap up, what are some of the special areas that you would want to be looking at when it comes to childcare?
So for this fundraising, as Father said, we need to expand our laboratory, radiology or X-ray units and the pharmacy. This is because most of our mothers who come may need more than the basic test that we are offering now. And many of them have to trek to other facilities. Most of the time they have to go to the teaching hospital or other labs. And it's very stressful for sometimes a mother who comes alone or a parent who comes alone to have to leave the facility, go to another place, get a bottle, come back, have the test done, send it again. It's a lot of work. So we want to encourage everybody to support us so that when children are seen, it will be like a one-stop shop.
Okay.
They come and receive a comprehensive service.
All right.
And they don't have to move around the city looking for other services.
Thank you.
Thank you so
Very
very
much.
much indeed. I believe that a lot of us have been touched. I've been touched, and I believe that you've been touched as well. The number to call 024-332-6643, and that goes directly to Father Neil Ante Campbell.
Thank you.
And whatever the help, please speak with them, and let's see this facility become the state-of-the-art facility that will serve the needs of our children in Ghana. Okay,
Thank
so
you.
that is
Thank
it.
you.
For this segment, thank you once again, Father Campbell, Board Chairman, Princess
you very
Marie
much.
Louise
Thank
Hospital, and Dr. Mamia Nyako is.
And can I take this
clinical.
opportunity just to thank all the people who've been supporting the hospital. We have many friends of the hospital and many friends also of the lepers. I want to also say, bring in the lepers. I'm going there now.
I know.
You know, just to say thank you to all the benefactors and friends.
Okay.
People have been so generous.
All right.
They've been so good to us in every way. Towards the Children's Hospital, people who come to donate and who've donated for this new building we have there, and also for the lepers and others, also for a new soup kitchen that we've started and under the bridge. I just want to say thank you to all people who've been helping in one way or the other. I'm most grateful. I pray God will bless them for.
Thank you,
Amen. And I
Father.
received one for myself. Dr. Mamia, Doc, you haven't told Father.
Thank you. Thank you very much. He's the best salesman in Ghana.
I
if not West Africa or Africa. Thank you very much. And
Thank you.
we wish you all the best with the fundraiser on Friday. British Council, 6 p.m. Raising
We'll be
funds for
there
the
to
Princess
support.
Marie Louise Hospital. This is GH Today on GH1.